Awesome. Well, thank you all so much for joining me this morning. I'm really excited to be here. I know there's been a sort of for a couple year hiatus for the post-acute annual training, but we're back and really excited to talk today about the National Healthcare Safety Network, or NHSN, and just give you an overview of the long-term care component, the past, the present, and where we're going in the future. My name is Theresa or Terry Rowe. I am the long-term care unit lead for the post-acute care team in their surveillance branch here at CDC. Prior to joining here full-time, I was a geriatrician at Northwestern University in Chicago and worked for over a decade or so in long-term care. So definitely really excited to go through this with everyone. So for those of you who have seen me talk before, I love starting with this slide. I think I stole it from Dr. Damali Stone many moons ago, but I think it's just gives us a visual and kind of puts into place how healthcare has shifted over the past couple decades. And I know we all know this in the crowd, but or in the virtual room, but I think it just really highlights how healthcare has shifted from that acute care setting, so this hospital at the top, to other settings, so into the post-acute care, long-term care, nursing home setting, and then into the other settings like home care and outpatient care. You know, we think about it, before patients at the hospital would spend, 20 days at the hospital to get antibiotics or complex wound care. And now they're spending, 1, 2, 3 days in the hospital, and then they're receiving the rest of their care in nursing homes. And so the complexity of nursing home care has really grown, especially over the past decade. And, that's why we're really here. And that's why the work that we all do is just so critical for resident care. Okay, few objectives for the presentation. Let me just move this screen a little bit, sorry. Okay, so we're gonna first discuss how the National Healthcare Safety Network, or NHSN, has evolved to meet the changing landscape in nursing homes, as we just discussed. Then we'll examine the benefits of infection surveillance in nursing homes and review examples of how surveillance improved resident safety during the pandemic. Finally, we'll review some upcoming changes and potential modifications to the surveillance that we do using the National Healthcare Safety Network, and also discuss potential opportunities to improve surveillance and resident safety. Now, I want to highlight here that I'm going to give you a kind of a brief overview of what's to come throughout the day. So I'm not going to go into too much depth, but there'll be presentations after this that will kind of explain everything that we're going to go through during this presentation. Okay, let's first talk about this sort of what I call the pre-COVID era, NHSN long-term care component from around 2009 to 2019. And I know this slide is crazy busy, and I don't think we're not gonna go through all of these different policy changes, but what I laid out on this slide is essentially nursing home policy and other important events that happened over the past decade that really improved resident care and got us thinking more about how to improve infection prevention and control, infection surveillance, and antibiotic use in nursing homes. Now, I did highlight 4 that I'm going to talk just briefly about. The first is the birth of the NHSN long-term care facility component in 2012. Prior to that, it was the NHSN was only available in the hospital setting. This is also older, but I think important. This was the Office of the Inspector General report that highlighted adverse events in skilled nursing facilities and really highlighted infections, and we'll get into that in a moment. Then there was the 2016 to 2018. It was a collaboration between CMS and CDC with some of the QIOs to get nursing homes or to encourage nursing homes to enroll in NHSN and report Clostridioides difficile infections, or CDIs. And then finally, this sort of pre-COVID policy that we want to discuss was the implementation of CMS's revised regulations for infection prevention and control programs in nursing homes. So let's go through each of these. Okay, so sorry, one slide's a little bit backwards, but we can start with the 2014 Office of the Inspector General report. And why this was so significant was that, out of all Medicare beneficiaries in skilled nursing facilities, they actually found that infections were the most common cause of harm, accounting for over a quarter of adverse events. And you can see I highlighted in this box here, what was really remarkable, what was also really remarkable was that infection events were deemed to actually be preventable about 60% of the time. So, over a quarter of adverse events, but most of them were actually preventable. And it also was one of the most common reasons for transfer from a hospital from the nursing home to the hospital at about 87%. So really just kind of highlighted the need for us to continue doing work in the nursing home setting, both from, infection prevention and control policies and from a surveillance policy to monitor what's going on in nursing homes. And as I mentioned, there was the CMS QuinnQIO initiative that to enroll nursing homes into NHSN to report CDI. And this was really remarkable because when NHSN long-term care component came out, it was very new. And there was certainly no, regulatory or, reason for nursing homes to necessarily report into NHSN. It was at a voluntary, state then. But with this project, they recruited about 2,300 nursing homes to enroll and report into NHSN. So that was a really big feat, especially at that time, to get all of those nursing homes to report that data. And they were able to report CDI data for about 2 years and developed a portfolio of training resources to support NHSN engagement and promote CDI prevention in the participating facilities. So really helped improve patient safety. And then finally, as I mentioned on our first slide, was the 2017 to 2019 revised regulations for infection prevention and control in nursing homes. And I broke out just a few of those components that I think are really applicable to NHSN and kind of where we are today. The first is that facilities must establish a system for preventing, identifying, reporting, investigating, and controlling infections and communicable diseases. And I put this arrow to NHSN because NHSN is the surveillance system that can really do a lot of this work. I also want to highlight the integration of infection prevention and control into quality assurance performance improvement activities, or QAPI. Antibiotic use protocols and monitoring including into IPC. And you're actually going to hear a great presentation later on in the day from Dr. Kabani and her team, the antibiotic stewardship team. And then finally, a facility should have a designated infection preventionist with specific training. And so pre-COVID, we still had about, 3,200 nursing homes reporting into the available modules. And to just remind everybody what those modules were pre-COVID, there was a healthcare associated infection module in which facilities could report different types of urinary tract infections, including catheter associated urinary tract infections, symptomatic urinary tract infections, and asymptomatic bacteremic urinary tract infections. There is a laboratory identified event module in which facilities would report CDI events and other multi-drug resistant organisms events as well. Lastly, there's the prevention process measures module, which included things like monitoring hand hygiene in the facility and gown and glove use. Okay, so then what happened with the pandemic? Things changed quite a bit, as I think many of you in the virtual audience are quite aware of. Okay, so here's a timeline of different, again, events and policies that sort of changed NHSN and changed how we think about surveillance in nursing homes during this time. So first was that NHSN, there was COVID-19 reporting for SNFs into NHSN. And then followed by COVID-19 testing requirements for outbreaks and staff testing. In May of 2021, the NHSN or facilities were to report COVID vaccine reporting into NHSN. And then I added these two. These are kind of sort of post-pandemic or right around the same time, but we'll get into these later. But I put them on here because I do think that they are important. The RSV, or the respiratory syncytial virus vaccine, becomes available for older adults. And then finally, and I'll describe this too in a few slides, NHSN added the option of beginning to include RSV and influenza cases and RSV and influenza vaccination reporting into NHSN. Again, this was an optional component, but it was also pretty critical just because we started thinking about kind of more broadly, what are the viruses that are really impacting long-term care facilities or nursing homes right now. And this just describes kind of what I just told you about the requirements for nursing homes to report, CMS requiring nursing homes to report COVID-19 facility data to the CDC. And then in May 2021, the vaccination requirements. And this was, I think a pretty, a significant event, as this was the first time that all facilities or CMS certified facilities across the nation were actually required to report into the surveillance system. And because facilities were required to report, 15,500, or almost all nursing facilities, did actually report into NHSN, and our long-term care component expanded. So in addition to the HAI modules, the laboratory identified event modules, the prevention process measures, we now were collecting COVID-19 cases and COVID-19 vaccinations. Now, each of these went through iterations over the years, and I didn't put all of that in here, but essentially collecting, cases, deaths, and now hospitalizations for COVID-19, and then, vaccination for residents and healthcare personnel. Now, I didn't want to leave off, sometimes this is the HPS component, our healthcare personnel safety component is not technically part of the long-term care component, but it is important for nursing homes because they report the healthcare personnel influenza vaccination in there. We also will hear about this later, just didn't want to leave it off. Okay. I just want to spend one or two slides. Again, we'll hear about this later. I need to stop saying that over and over again, but these next few slides, I think, just really highlight how the data from NHSN during the COVID pandemic was used for public health action and actually used for individual facilities to improve resident safety. As I mentioned, it was the primary data source used to track nursing home outbreaks, and that provided additional resources to those facilities that might have needed additional help. The data from NHSN was used for driving policies around vaccination requirements for nursing home residents and healthcare workers. There were some VE related studies that were done using the NHSN data. And then data from NHSN was used to inform outbreak response teams and other emergency operations by identifying nursing homes at greatest risk for outbreaks and for greatest risk for morbidity and mortality. So again, really helped us from a public health perspective, but also from an individual nursing home perspective as well to improve the resident safety. I wish I could put all the publications in here, but if you type in NHSN and PubMed and long-term care facilities, you'll find, tons and tons of publications in which, the value of the data that was submitted really shines through here, and how much work we were able to do, or, everyone was able to do with what was reported into NHSN. I selected a few. They might be, I tried to make them linked, but if not, you can copy and paste. But I think these are some of the, more, papers that were a little bit more, I don't know I can't think of the right word right now, but I think, very important for the work that we all continue to do. And this is just an example of how, the public could use the data that were put into NHSN to help look at, where COVID was at different points in time, and just to have an overview of the epidemiology of COVID, that window into what is actually going on in nursing homes. And before this, we didn't have that. So really a very sort of memorable time. Okay. Switching gears just a little bit now, I know this is kind of post-pandemic, but I did want to just highlight the RSV vaccination and its approval, because that does get into some of the work that we're going to be doing in the future. So the RSV vaccines, are approved by the FDA in May of 2023. ACIP recommended both vaccines in June of 2023. And then, as many of you probably know, there was updated guidance in 2024. And I won't get into this too much, but essentially, recommended RSV vaccines for everyone ages 75 and older, and then those at increased risk who are 60 to 74, and that includes those who are residents in nursing homes or other long-term care facilities. Okay, so that I think the RSV vaccine coming out sort of just made us think about how we know that COVID causes significant morbidity and mortality in nursing homes, but so do other respiratory viruses, right? And that sort of led to some modification of the COVID-19 modules, into which we added RSV and influenza cases as an optional reporting data elements for both cases and for vaccination. And so facilities can now report RSV influenza and cases and RSV influenza and vaccination optionally if they choose to. And again, this was, when we sort of thought about like, well, what causes significant morbidity and mortality in nursing home residents, and what are potentially, preventable with vaccinations. It sort of led us to move towards this expansion, or I should say addition. Okay. So now let's spend just a little bit of time on NHSN Long-Term Care Component 2024 and beyond, and talk a little bit about, what we're anticipating for the future. And then, I think we'd also really love, to hear from folks in the audience. I know we might not be able to do it at the end of this presentation, but, if others have thoughts and ideas, I think we're always, open to, hearing from you. So first, I want to just highlight a few challenges that we had sort of pre-pandemic, and then, how they may have been addressed and what are the opportunities for NHSN in the post-pandemic world. So because there are some differences. I think the first, nursing homes, there was a few studies, or one or two studies that, just said that, pre-pandemic nursing homes were not aware of NHSN, particularly before the QuinnQIO program. And that has mostly resolved, as most skilled nursing facilities are now enrolled in NHSN, and are able to report data into NHSN. We definitely heard before that there were challenges with enrollment, either facility or user enrollment into NHSN. It was sort of a lengthy, more complicated process. And there have been a lot of improvements in that as well. And there actually will be a short presentation on this, and that you can now use an authentication token, as opposed to having to mail and get the grid card and wait for the grid card. So that process has really sped up and often can be done in about 20 to 30 minutes. Now, we recognize that most of the modules for long-term care still require some manual reporting, which, certainly requires time commitment on the behalf of, facilities. But we've really been working to improvements in our user interface, person level data reporting, and have, definitely very, forward focused on, how can we use electronic data reporting, and try to minimize the amount of manual reporting in the future. And then lastly, I think we've heard too that, how can we make, NHSN more useful for a more broader set of nursing homes, and we've heard things like, okay, can we add things like RSV, and what about influenza, and what about antibiotic use? And so those two, there are some up and coming changes to, sorry, I'm just going to minimize this. Those modules, and we'll hear about those later. But the first is, how we are, adding optionally the influenza and RSV reporting, but also some modifications to the vaccination and the cases, the COVID-19 module itself, to make it more user-friendly and a combined form. And I'll talk about that in just a moment. and then potentially adding antibiotic use module. Okay, so the first I'll talk about that respiratory pathogen surveillance and vaccination combined module, which is up and coming. And you'll see this slide later too, but I stuck it in here as well because I love it. But I think it just highlights like why we are kind of focusing on these three respiratory viruses right now. And really because they are, major causes of morbidity and mortality in this nursing home population. But for influenza, there's vaccine, there's treatment, and there's prophylaxis, and you need to get treatment and prophylaxis started pretty quickly after detection. For COVID, vaccination and treatment, and similar with treatment, you want to start it as early as possible. And now for RSV, we actually have an RSV vaccine. Okay, so here are some of the proposed changes for the respiratory pathogen surveillance and vaccination module that we anticipate to come out either later this year or beginning of next year. But essentially, what these proposed changes might look like is to really help the user only have to go to sort of one place to be able to enter in data on their COVID cases and their COVID, RSV, and influenza cases, and their COVID, RSV, and influenza vaccination. And again, you'll hear a whole lecture or presentation about this in just about an hour or so. But we really thought about it, how to make it more user-friendly for nursing homes. And then the long-term care antibiotic use module. And this was really born out of, some of the recommendations from the 2019 rule that I presented earlier, and that there is an expectation for nursing homes to have a system to monitor antibiotic use. We thought, how do we do this with limited resources and in a meaningful way? What were some of the other, objectives from a both public health perspective and also facility objectives? We certainly wanted to support nursing home staff and using, any antibiotic use data to implement and monitor stewardship activities to improve resident care. This could help us, track and report antibiotic use rates nationally, and then even establish, risk-adjusted AU benchmarks for nursing homes. So a lot of different potential objectives with a long-term care antibiotic use module. And so the proposed module would actually be all electronic data reporting, no manual reporting. We anticipate that we would have this module available in the spring of 2025. And we hope to make those data, readily available to nursing homes so that they can use them, so that you can use them in your, QAPI meetings or to evaluate antibiotic stewardship programs. Now, obviously, we understand that there are still a lot of limitations with respect to the electronic health records and how and how nursing homes use them and how that data transfers from the electronic health records into NHSN. So just to say, a lot of work still to do, but I think really exciting that there's the potential for facilities to use this module in NHSN to help, improve their antibiotic use. And so here's kind of our vision, at least for the next couple of years or year or two. And it looks a little bit more busy, but we have the antibiotic use module all the way on the left, which would capture antibiotic prescriptions, the respiratory pathogen and surveillance module, which would capture resident COVID-19, RSV, influenza cases and vaccinations. We would continue to work on the healthcare-associated infection modules, which capture urinary tract infections, lab ID event modules, prevention process modules, and again, don't want to forget the healthcare personnel influenza vaccination. And I do want to just mention one other thing that we have been, really looking at our three older modules and thinking of ways to improve and make them more user-friendly for nursing homes. Okay, so in conclusion, the National Healthcare Safety Network, NHSN, long-term care component has evolved over the past decade as healthcare has shifted to post-acute care settings. Collection of COVID-19 cases and vaccination in NHSN was really integral to developing, I think policies aimed at improving safety of nursing home residents and was provided real-time data to nursing homes to improve infection prevention and control practices. And then I think we are continuing, and NHSN continues to develop to meet the changing needs of nursing homes, with the focus of improving resident safety. And with that, I will end. But thank you all so much.